How do you pronounce it, Omicron or Omicron? Well, we're back here at Cobb and Douglas Public Health for another episode of COVID in Cobb, perhaps one of the longest running series in Cobb TV history. As always, we talk with Dr. Janet Memark. She's the director here at CDPH.
Right now, we're trying to gauge how the holidays will affect us. We had a lot of people traveling over the holidays, and probably what I understand is record numbers of people that have been traveling. So case numbers right now, we are seeing a few places around the state having a slight increase in number of cases and hospitalizations. And for Cobb, we never really went all the way down. So we're still at 168 cases per 100,000. And this is from yesterday's numbers. So that still remains in high transmission. And we've also seen an increase in the percent positive, meaning that there are more people that are coming back positive on tests. So still at 4.8%, which is less than 5 and definitely less than 10, but definitely not trending in the right direction, considering with all the other news that's happening these days.
Speaking of which, Omicron, however you want to pronounce it, it's all over the news. And honestly, you hear different things about it. So where do we stand with that?
All right, so let's talk about Omicron. So Omicron is another variant that is now a variant of concern as per the World Health Organization. Now, why all of this, hoopla and everything over this, okay? Because there are more things that we don't know about it than what we do know about it, okay? So what we know right now is it has 50 mutations on this virus. And so, the ones that we had previously would have a few mutations at a time, and then we got Delta, and we got Beta, we got all different kinds. This one has 50, and 30 of those are on the S protein. Some of you who are following this know the significance of the S protein has to do with our vaccines, first of all, and our immune system. So that's what was so concerning to folks. So there is a possibility that it is more transmissible and that it may evade our immune systems and the vaccines. Now, that's possible because we don't know at this point. So what we do know is that it spread rapidly in South Africa. Now, the vaccination rate in South Africa is very different from what we see here. So it's not really comparing apples to apples at this point. So what they're looking at all the things that we talked about. Is it more transmissible? How do our vaccines do against it? What does even the disease look like? Like are you gonna get sicker or is it milder? We don't know. Is it gonna overtake Delta? We're at over 99% is Delta right now. Can it overtake Delta? We don't know. So, why all the shutdowns? At this point, I think everybody's just buying time at this point. But since, the shutdowns, we only had a few countries that had said that they had identified Omicron. Now we're over 20 countries that have it, and from last night, over 200 cases. We, shut down the flights too late. It had already spread out everywhere. So we're waiting to hear. But we don't have a whole lot of answers, but it is something that's being watched.
So one thing I'm curious about, and you hear this all the time, is how will we know Omicron is here? I mean, how do you test for these variants or determine these variants are even here?
Yeah, so that's a great question. We asked that yesterday on the state call, that whether our testing would be able to pick it up or what have you. So our testing now can pick it up. So the regular COVID testing will pick it up. And we're sending a lot of tests out for genetic sequencing. So they're doing more genetic sequencing than they were doing before. So we have one of our labs that does some of our testing actually sequences all of their positive tests. So that's great news. So we should pick up on what's happening. We have the Georgia Public Health Lab that's also sequencing, and CDC that's doing sequencing as well. So they have a lot of sequencing, and if there's someone that's identified as higher risk, like I was just in South Africa, my friend has come back positive, now I have symptoms, that person can be sequenced as well. So if you get a regular COVID test, it will come up positive if you have it, and then if there's something they'll look at, either automatically it'll be sent, or it will be, if it looks suspicious, they'll send it for sequencing.
So one of the questions I get all the time is, though, if I go to CVS and get a test, or one of those private places, or a home test, does that factor in?
Yeah, so it is unclear if the rapid test can pick up on it. So that's one thing. If anything picks up on it, it's probably going to be the PCR test right now. So remember the gold standard. So it's not the one you'll get back in 15, 30 minutes. And so I'm not sure where CVS does their labs. So I can't really tell you that, but I know from our testing sites, then we do have some sequencing that will happen. But it'll get picked up on if, maybe not every single one though, but they'll find it soon.
When we last talked, you were worried about a bump following the holidays. Is it too soon to tell whether that's bumped or not?
Yeah, I think we are seeing some more activity. My team is getting a lot of calls, so I think we're going to have a bit more activity. So we're just hoping it's not going to be as bad, but it's too soon to tell just how bad it's going to be. But there is a little bit more activity right now.
What about on vaccinations? Is there activity on that?
Yeah, so that's a great question. So I was really proud to find when I looked at our Cobb vaccination rates that we're doing pretty good. We have about 62% at least first vaccine, but I saw our 10 to 14-year-olds are about 38%. That's really, really good. And so we have vaccines that are available now. Our 5 to 9-year-olds, that was a little bit low at 10%. So it's important to get people vaccinated right now. So your next question may be, how do we prevent, getting Omicron? How do we prevent the transmission? Well, it's the same stuff that we were doing before. So, we need to get vaccinated. So we don't know if the vaccine, if it's going to be 100% effective or not. But we do know so far it has stood up against every variant and really decreased the number of hospitalizations and deaths. Now, it's not 100%, right? Now, but what's important is that we're seeing immunity go down. Right? So at this time, you and me and people who got them earlier, the vaccines, the immunity levels are going down. So the CDC has recommended anyone over 18 to get your booster shot. 6 months after the second dose of one of your vaccines or 2 months after Johnson & Johnson, get your booster, because you may have a false sense of security going out there against Omicron, and then you may not have the immunity that you think you have. So get that done, and children are doing so well. My 11-year-old did great with his vaccine. Remember, the Pfizer vaccine for younger children is only 1/3 the dose of the adult vaccine. So very important, and it did not have those side effects of myocarditis and pericarditis. Even though they were rare, they have not seen any in the thousands and thousands of children that they've vaccinated.
So when we were talking before this started, and we mentioned that the rate is still in that mid-100 range and bouncing, going up a little higher even, I sensed a little twinge of disappointment in your voice. So where do we go from here?
So that's a really, really great question. And so, we heard something recently that Dr. Fauci had mentioned that, we probably will not be able to eradicate this, but I'm feeling like this is looking like another seasonal virus that we see. And so you see right away that, we have a new variant that's out. We don't know yet the impact or what's going to happen, but we know what we need to do, right? You need to wear your mask and avoid, large crowds and things like that. Get your vaccine. But already the vaccine companies are working on a booster that will be able to incorporate that new variant. So does that sound familiar? Every year we got something new that, may not be 100%, but it'll prevent you from going to the hospital or dying, right? So it's very much like influenza to me. And so I wouldn't be surprised, if as long as these vaccine companies can keep up with this and the vaccine continues to work, that's kind of what happens. So, we just need to be safe and make sure you have your immunity available to you and not be one of those people that didn't have any immunity to the virus.